Hi, hi students. I am Dr. Badrinath, National Leprosy Control Program. How our great nation has fight, eradicate, how it controls the leprosy. That is the topic of today. NLCP, National Leprosy Control Program. Right? This is the symbol of this program, lotus. Lotus, a very beautiful lotus. It is a symbol of the very quite interesting why they have designed this symbol. It was quite interesting. A beautiful lotus is the symbol of this program, National Leprosy Control Program, NLCP. This is the official logo of this program. See here, you can see the lotus. These are the center part of the logos inside, how it will be, and it looks like a finger. These are the two fingers, first finger and second finger. These are the two fingers. These are the remaining fingers. Okay, and this construct like a house. It looks like a constructed house. Okay, this is official logo of NLCP, lotus. Why they have made this symbol? Why they have? Because lotus is very beautiful, but the situation of leprosy patients is like that. It's we can't see them in a good that is in a thing manner, not like a ordinary persons. Like we cannot see like them. Okay, it is somewhat the society is looking for them in a separate way. Society. So lotus is came from dirty pond. From dirty pond, the beautiful lotus will come. That is also indicates the symbol. Leprosy patients also, they are in a very dark condition, very dark condition. So they will be brightened after this program. They will be enlightened like a pond. That is a specialty of this. You know, leprosy. Okay, nose will be damaged, face will be damaged, eyes will be damaged, eyebrows will be damaged, fingers, they do not have a fingers, they do not have a toys. Very this is a very critical disease, it was, right? So we are studying a subject of social and preventive pharmacy. Okay, also called as social and preventive medicine. It is for all MBBS, for nursing, pharmacy, lab technician, for everything and all. And this is your syllabus: objectives, functioning, and outcome. What are the objectives? What are the functioning? What are the outcomes? These are the 3 points. These are the 3 points. What we have to focus, that is there in the syllabus. In the syllabus, they have mentioned remaining and all, how the TB is developed. How the leprosy is developed. That and all not a matter here. That's we are not bothering. Objectives, functioning, and outcome of the program. Okay, National Leprosy Control Program. This is our today's okay topic. Yeah, what are the points I have covered about? The first one is very important, and emblem, logo, and symbol. Introduction and objectives of NLCP, NLEP, eradication program, that I will explain you, and elimination of strategies, functions, action plan, also called as a functions or action plan, work plan, strategy, whatever it may be. Okay, how they have eliminated it, and outcome, what they have achieved finally. Okay, so keep your symbol like this. This is the symbol of the leprosy program. Okay, a beautiful lotus will come from a dirty pond, right? Yeah, first of all, you have to know National Leprosy Control Program, NLCP, is nothing but NLEP, National Leprosy Eradication Program. That's it. Both are same only. It is name is changed in the year of 1983. It is started in 1955. It was launched. It was it is a continuation only. Continuation, same program. Here it is control. Here it is eradication program. First they have made a control. Later eradicate. Control means, you know, reducing the leprosy cases is called as a control. Eradication means completely wash out from the India leprosy virus or leprosy bacteria, whatever is there, that completely they have to eradicate from the India. That is why they have first they made it control, later eradicate. Because at a time eradication means not possible. Even they also know. That's why they have designed a title like that. Okay, how many years it took for controlling? 55 to 83, almost 30 years. Okay, around 30 years. 30 years they took to control the program. Later they have eradicated. So that's why it was a tough. Okay, so yeah, now you can see the symbol, the emblem or logo. It indicates the beauty and purity of the lotus. That much of purely you can, leprosy patients can be converted because it is a curable. Leprosy patients will be thought that my nose is damaged, my fingers are damaged. How I will again become a very beautiful man? Like that they will think. Yes, it is possible with the plastic surgery. That is also a part of this scheme. They are making plastic surgery to the nose, eyebrows, to the fingers, to eyes, and they are making. That's why a beautiful person can be come out. A leprosy patient can become into the beautiful person. Okay, I will show you some pictures also. So leprosy can be cured. Leprosy patient can be a useful member of the society. Okay, society will see them not properly. They will ignore them. Okay, they will feel not to touch them like that. But however, it will be, they will become a very good and excellent and beautiful persons like that. Normally, forefinger. These are the forefinger represent the shape of the house, the symbol of the hope. This is a ray of hope is there. Emblem captures the spirit of hope. That is and all about the, that is a emblem. Here you can see the NLCP, NLEP. See, first of all, centrally sponsored health scheme. This is central government, not a state government. Centrally sponsored health scheme. This is a health scheme, not a health, this one, coverage. Not like LIC policy, not like a health policy or life insurance or health insurance. Okay, it is a health scheme introduced by the central government, by the Ministry of Health and Family Welfare, Government of India only. WHO is also something that is about the world leprosy eradication program. That is not matter here. Okay, and program head, who is the head of this program, is the Deputy Director Health Services of the Leprosy Separate Division. And this department, this program, this work under administrative control of the DGHS, Director General of the Health Services, that we know. Aim is this aim is different. Control, here the name itself indicates control, to control the number of leprosy infections in India. That is a main aim and our objective, whatever it may be. That is a NLCP, about NLCP. The same NLCP only 1983. This became into the 1983. Name is changed. National Leprosy Eradication Program. First they controlled, 30 years nearly they took for the control, and later they started of eradicated. Aim is changed to eradicate here. See here, aim is to control. Here to eradicate the change. Because of the number of cases are already decreased in NLCP. Number of cases gradually, it was successful program. Super success. Okay. Strategies also changed. Introduced a multi-drug therapy here. Here they didn't introduce it. First, after controlling, for eradication, they introduced this multi-drug therapy. This is also super success. Okay. Supported by the World Bank. This program is supported by the World Bank. World Bank first support, he has given two supports. First time one support he has given 1993 to 2000 and 2001 to 2002. Second support project from WP, that is a World Bank. Okay, and 2009 special action plan was introduced. Special focus on 209 high endemic districts in 16 states. Especially they focused in the 2009 about the leprosy portion, so that they have eradicated completely. These are the Zoom, like a Zoom. We will go through a Zoom, no? In the Zoom, they zoomed on this special focus on that. Okay, program supported by WHO. This program is supported by WHO also. ILEP, International Federation of Anti-Leprosy Association. They have taken World Bank help. They have taken WHO help, ILEP help, NGOs, non-governmental organizations also. They have participated very actively. Okay, right. And strategies, how they made this success. What are the secret of the success? If you go and ask them, they will tell. These are some points are there. What are the points? We will see. Sweet and short. That's it. Elimination strategies. First one is they have decentralized. Since it is a national program, who will go to village? I am a national, I am in the Delhi, I am sitting always and I want to see the leprosy patient. Nobody can see if you're sitting in a Delhi and all. That's why they have decentralized. Okay, they are in the villages, they are in the towns. Okay, so this is a centralized. They decentralized. First one, decentralized integrated leprosy services through the general health system. Okay, first one is the decentralization. Point number one. Okay, number two, early detection. This is very, very important. Once after damaging everything, it will be very risky. They can come back, but it was very risky. Instead of that, early detection is better for early prevention. Early detection, complete the treatment of the new leprosy cases. Very excellent. This was the strategy. Early detection, even corona also early detection is better, not late detection. Late detection means hypoxia will come, everything will be gone. Okay, it is very dangerous. And number 3, this is number 2, point number 2, and point number 3 is carrying out the household survey. Like they will go to house and they will ask either leprosy patient is there, or they will tell you, explain the symptoms. Is there all these symptoms are there in your house? Is there anybody suffering? Don't feel shy. You have to tell, like that, carrying out the household survey detection. Okay, on the child base. Okay, on the multibacillary, even child's also there. Is a point number 3. Okay. Now point number 4. Involvement of ASHA workers. They took a very great help of the ASHA workers. They are also doing very excellently. What are the ASHA workers? ASHA is nothing but accredited social health activists. Okay, in the detection of the suspected cases, like that. Okay, suspected cases, they will go to the house. If anybody is feeling that, they will give area, because ASHA workers are just like a micro units of the total entire system. They will observe the 10 to 15 houses under them, or 50 houses. They will keep on watching that. If any suspected case is there, early detection is there. Follow up all the cases, early detection of the suspected cases, follow up of all cases of treatment. Once they started treatment, ASHA workers, it is main job. The patient should not left the treatment. He has to complete the treatment. That's the main intention. That's why they will follow up. What happened, either cure is there or not, like that. And advice, they will give advice and motivate self-care practices by the disabled dashes, and the spreading awareness. They will also give the spreading awareness. Don't touch them, don't inhale their air, whatever it may be, inhalations and all. And they will give, government also given the incentives to the ASHA workers. These ASHA logos, 250 for each confirmation of the case. If they will detect the each case by going to their home or suspected, whatever it may be, they are giving a 250 rupees in those days, and 400 rupees for completion of a treatment. So they have to follow up the new case. See, once they find the new case, 250 rupees, and they have to follow the case. Either he is taking a treatment, giving a guidance, everything. Once they have, this is additionally, not apart. This is apart from the salary they are giving. Like that, they are encouraging. Otherwise, nobody will go. ASHA workers feel, why we have to go? We may also get an leprosy. Like that, they will also think. So instead of that, they are giving an some. These are the things. And fifth one is involvement of NGOs, non-governmental organization. India is having a number of non-governmental organization. Top 10. If you see the top 10, top 1 is CRI, Child Rights and You, CRY. Children will cry, no? That's why they made symbol as a cry. It's a Child Rights and You. It's a involvement, first non-governmental organization. Example is CRI, that you can be right in this exam, Child Rights and You. To reduce the IEC, BCC stigma, that is the main intention. That is nothing but new cases. To find the referral suspects, see here, suspects. If any suspects is there, they have to find a reference. Diagnosis, provision of MDT, multi-drug therapy, provisions they have to provide. Follow up of the cases, same as that of the ASHA workers also. Treatment adherence, either the patient is adhered to the treatment or it is detached from the treatment and went outside. Outpatient and inpatient care. Those who joined in a hospital is inpatient. Those who came and take a treatment and went outside, that is called as a outpatient. DPMR, I will explain you what is DPMR in the next slide. Referral and conduct of RCE. What is RCE? I will tell you in the coming slide. And 290 NGOs getting a grant. For NGOs also, government is giving a grant. Full amount. They have taken full heavy amount from the government. So NGOs also involved. Grant from Government of India under very set scheme, SCET set scheme. Okay, DPMR. I told no DPMR. What is DPMR? That here we'll see. Disability prevent. They will get disabled like this. See here, disable. Hands will not be there. Legs disable, like that. Disability prevention and medical rehabilitation. Medical rehabilitation. This is called a DPMR. This DPMR they have introduced. This is one of the strategy of this national leprosy program. Dressing material they will provide you to the leprosy patient. Supporting medicine they will give you. Ulcer kit they will give you to the patient. Okay, this is the first one. Microcellular rubber footwear they will give freely to the patient. Okay, government is giving under the DPMR scheme. That's very, very important, DPMR scheme. And reconstructive surgery. That's why here rehabilitation, prevention. They are prevent the disability. First one. Even though there is disability is there, they will rehabilitate by using a surgery like this surgery. Okay, reconstructive surgery, RCS. That's why here I have mentioned RCS, reconstructive surgery, which is organs which are already damaged. That they live like this. See here how the after operation he will become a normal. Okay, before this is the condition like that, right? Economical help to each patient. They are giving each patient also. Not only that, see how many intensive are giving DPMR. All DPMR activities are implemented at a three-tier system: primary, secondary, tertiary level, right from the upper to lower. First 8,000 rupees paid to the patient for RC, reconstitutive surgery. You get a treatment like that, 8,000 rupees in those days they are giving. 5,000 rupees paid to the hospital for surgery. Same surgery, patient 8,000 rupees, doctor will get a 5,000 rupees, patient will get 8,000. Indoor surgery, RCS, if they will do in the operation theater. Additional payment of 5,000 if they did operation in the outdoor campaign like this, like a free camp they will put and they will do a surgery. Outdoor campaign they are giving additionally 5,000 rupees in those days, right? Next is MDT, multi-dose treatment. This is the thing. For multi-bacillary, two types of bacillary is there. One is multi-bacillary leprosy, MDT, multi-dose treatment for multi-bacillary leprosy. Adults, child's 14 years, child 6 to 9 years. Day one, they has that 1 day is enough rifampicin. That's it. Rifampicin is 1 day is enough. Okay, Dapsone is also Dapsone and Clofazimine. These are the continuous. So single dose rifampicin will prevent the disease, eradicates the disease. One tablet is enough. One tablet, one time, one dose is enough. Rifampicin. So rifampicin day one they have to follow, and day 2 to 28 days they have to follow this one, daily clofazimine. So it will be cured. Okay, it's not. If you detect it, it will be very easily you can be cured. It's not a tough disease like a TB. Supervised monthly treatment, day one for child's rifampicin, clofazimine, same dose is reduced here. The remaining are same, clofazimine and dapsone. Here the three. Rifampicin is only the extra. Okay, this is supervised monthly treatment. This is a monthly treatment. This is a monthly treatment every month. And paucibacillary, pause, just like a pause. Pause, keep in your mind, because organism growth will be paused and again it will be developed. When you give a medication, it suppresses, it undergoes a pause condition. Again, it paucibacillary, okay, leprosy like that you can remember. This is for same treatment only, rifampicin and dapsone here. Rifampicin, dapsone is continuation. Rifampicin one tablet is enough. See here, chemoprophylaxis. It is nothing but prevention. There is a vaccines now. Here see before the vaccine, you see this point. Chemoprophylaxis, single dose of rifampicin is more than enough to kill the entire bacteria which is present in the thing. And vaccines here you can see BCG vaccine, very Bacillus calmette Garvan vaccine, and ICRC vaccine. Here you can see ICRC. This is a Indian Cancer Research Center has developed one leprosy vaccine. That is a IC. It is called as a ICRC vaccine, and MIP vaccine, Mycobacterium indicus prani. Here you can see here. See my pointer or cursor. See here MIP is there. MIP. Okay, MIP. This is a MIP vaccine. It's a new leprosy vaccine. And chemoprophylaxis prevention, rifampicin, one tablet, one dose is enough. That's why only 1 day. And next is they have established, the government is establishing number of research centers on leprosy. See here, National Leprosy Teaching and Research Institution. This is a central, national level, or also called as a central. You can see here, national or central, NLTRI or CLTRI. Central or national, you can use it anyone. It is Changalpattu, Tamil Nadu. It is very popular here. You can see that also. Welcome to Central Leprosy Teaching and Research Institution, Tirumani, Changalpattu. Okay, you can go and watch that. See here, CLI, see CLTRI, CLT and RI. Here you can see this is a this is centrally only one will be there. National or central one will be there. Under that regional, different regions, south, north, east, west, different regions will be there. So this is Regional Leprosy Training Center in the Chhattisgarh and Orissa Regional Leprosy Training, and same only RLTRI. This is called as a regional. This is called a central, right? Or national, whatever it may be. So regional leprosy present in the ASHA, Orissa, ASK, Ask Orissa, it is a Raipur, Chhattisgarh, and Gauripur, okay, Bankura, West Bengal. Like that, they have placed in a different ways. Yeah, this is outcome, and this is the end of the slide. Beautiful India they made. Leprosy. This is a leprosy-free India now. See how many here you can see the declining leprosy prevention in India. 32 districts here you can see the pointer. 32 districts out of 35 states. 32 states out of 35 states came free from the leprosy. That is the outcome of this program. So 32 states, here I have mentioned, same point I have mentioned here, 32 states out of 35 states successfully eliminated the leprosy. 554 districts out of 682 eliminated leprosy successfully. Decreases in the annual, see here, annual new case detection rate. New cases every year. Previously it was 10.78, almost 11%. Now they have reduced it to 7.5, like that. So with by using this program, okay, this is the outcome. So we will stop my session here. You keep watching. In my playlist I have kept all subject